Hey there, Dr. Josh here from Hometown Health. Today I want to talk to you about a wonderful disease that we call pregnancy. Now, I call it a disease because let's face it, pregnancy changes everything in a woman's body, but at the end you finally get a beautiful baby as a blessing. So I wanted to use a pregnant woman to demonstrate and discuss a lot of these issues that come along with pregnancy throughout their pregnancy. So today we have my lovely wife, Jamie, and we're excited to announce our second baby, Gregory, coming in October. And Jamie has graciously agreed to allow us to step through this process with her and to follow her through her pregnancy in the hopes that it will help some of you. So, as we all know, the abdomen during pregnancy expands outward. So this change in the size and the weight distribution of the abdomen does a few things. It changes your posture and your gait and your biomechanics, which in turn requires a larger lordosis or curvature in the low back, which then puts pressure on the pelvis as well as the lumbar spine. These changes in posture can also increase the pressure and the strain on the thoracic and cervical spine as well. And if you ask any late-term pregnant woman, they'll probably tell you that there's some breathing trouble associated as well as headaches associated with the pregnancy a lot of times. So today we're going to talk a little bit about what we can do for that. For a pregnant woman, we need a lot less force in order to adjust them. We use a lot less force because we don't want to press as much on their abdomen, putting pressure on the baby. We also don't need as much force because pregnant women have a hormone called relaxin, which is intended to help with the delivery process, but it also in turn helps to relax all of the other joints and ligaments in the body. So we don't need as much force as you would typically think of for a regular chiropractic adjustment. So I want to demonstrate on Jamie here what an adjustment would look like for a pregnant woman. So allow me to demonstrate. For the pelvis, we want to be able to get the pelvis moving because getting these joints moving is going to alleviate a lot of the pain that's associated with the pregnancy. So we use a belly pillow or a pregnancy pillow to take pressure off of the abdomen. And then we use what's called a drop technique. And it's just a small little piece on the table here that pops up like this and allows us to use a lot less force when adjusting the pelvis. We can use it on the pelvis and we can use it partially on the low back, but in later term pregnancy we don't want to do that. Now in the thoracic and the cervical spine, we can use just the same types of adjustments that we would typically use, just with a lot less force. So these are just some of the issues that we tend to see with pregnancy. We also see some other issues, such as sciatica and carpal tunnel syndrome. We're going to be following Jamie through this pregnancy, which we're really excited about and we're very appreciative of. And we're going to be looking at some of the issues that she might encounter throughout. So stay tuned for that. We've had a lot of great success with pregnant women, and there's a lot of small tips that we can give you for at home, as well as ways that we can treat you here in the office in order to allow you to have the best pregnancy possible, as well as the best birthing and delivery processes possible. Yes, we can help impact that sometimes. So stay tuned for all of that. Now, if you know of anybody that is pregnant or is trying to get pregnant or will be pregnant soon, please be sure to share it with them so that they can stay tuned and they can follow through with us as Jamie goes through her pregnancy, as they'll probably be dealing with a lot of the same issues. So thanks for tuning in today. If you have any questions or would like to learn more, feel free to check us out online at www.hometownhealthoxford.com, or you can give us a call at 610-467-1141. Thanks for tuning in. Until next time, stay healthy.
What the hell?